we've evolved our strategies now. We've really focused on those marginalised groups, because that's where the decay is. That's where we can make such a difference now.
Hi, I'm Laura Neilson and welcome to Hope in the Deep End. We've put together this podcast to inspire us all to keep working in areas of deprivation and poverty. We're sharing best practice, stories, outcomes and some interesting thoughts and ideas. So whether you're working in primary care, secondary care, the charity sector or any of the other myriad of roles, please listen and help us to keep each other inspired.
So welcome to the Hope in the Deep End podcast for this week. We are recording this on World Oral Health Day, apparently, which I did not know about. So I'm here with Christina and Ben, who are both dentists and expert in oral health, and we are going to talk about teeth for the next half an hour or so. So welcome, you guys.
Thank you.
Thank you so much.
So Christina, you're currently working in a women's prison 2 days a week, which must be really interesting. And then you lecture in the southwest at the dental school, doing something called restorative dentistry, which is not restorative justice, something different.
Yeah, that's correct. Yeah.
And Ben, you have been the past president of the Oral Health Foundation, been a dentist for far too long. We won't mention how long. And your current interest is actually beekeeping, which will be a different podcast.
Full different podcast, but yes, thank you very much.
Yeah, but it's great to have you guys here.
Thank you.
So, dentistry is something that comes up a lot. So when I'm working in A&E, it's horrible having patients come in with dental problems because, I mean, effectively, I know nothing and I can't help them. And then also we found in primary care that more and more people are struggling with their teeth, with accessing dentistry, with what to do. So what we'd like to talk about is what positive things can people do to look after their own teeth? What can we do to help patients? And then we're going to talk a little bit about what we think the NHS should do. Is that all right? So who wants to go first? Yep. Who's going to say, what should we all be doing for our teeth? Let's start basics.
I'll leave that to you, Christina. That's
Oh, goodness. Okay. So I think really do the basics well. So brush twice a day with fluoride toothpaste. And that's, I think, unless you've gone out of your way to buy non-fluoride toothpaste, you will find that your toothpaste had fluoride in. You can read that on the back. And for 2 minutes, you can do a good job with a manual brush or an electric brush. I find that when I brush with a manual brush, I tend to think about everything else in my day and brush for about 20 seconds, whereas it always seems quite a long time using electric toothbrush. So I do think they're maybe slightly better, but again, you can do a good job with a timer and a manual brush. And so I'm sure, Ben, you might have some other bits to come in on, but also the other one is cut down on how often you're having sugary foods. So the research, I think, shows that you can have 4 sugar hits a day, and that does include anything you drink, eat, including your meals, without causing too many problems for your teeth. So if you're a sweet snacker or you like lots of sugar in your tea, you might want to think about cutting down because you might be putting yourself at risk of tooth decay.
Oh, rubbish. We won't be invited. So does that include fruit? So like I'm a grazer on fruit. So is that a sugar? I guess it would be a sugar hit, wouldn't it, eating?
It's not as bad because in fruit, the sugars are held inside the cells of the fruit. If you're kind of having things like smoothies though, even though they're tagged as healthy, it can start to be a bit of a problem. So I think it's much better to be snacking on fruit than it is to be snacking on Haribo, but it can have other issues to do with erosion of your teeth, but I'm certainly not going to be telling people not to have fruit. I think it probably does come down then to some individual circumstances.
Okay. So the bananas beat Haribo. That's always good to know, isn't it?
Yeah, bananas beat Haribo in lots of ways, not just
in lots of ways. Yeah, that's great. And in terms of toothpaste, like when you walk into the supermarket, there's like a whole plethora of toothpaste, isn't there? With all this, like, I mean, they're meant to like transform your life. They say on the boxes. Does it matter really, or is it just about fluoride and brushing properly?
I think for me is the key thing at the back. Turn the package over, and if it says 1450 ppm, which is parts per million, that's your toothpaste. The rest is, but for aesthetic, they do whitening, they do lots of other, like you say, they will cure mankind's ailments. They are amazing. However, when I look at my children's teeth, my daughter wouldn't brush her teeth with the mint because it's like I'm burning her mouth, as a young. So there are strawberry flavors. So if you can't find the toothpaste that you like, change. There's some great ones that you can get the own brands, and they can be little 50 pence. And I recommend this often to my patients, especially with the homeless guys. Well, it's too expensive to buy the £5 toothpaste, and I do agree. So I have to buy my own toothpaste because my wife says I never bring it home from work, and I do. I forget constantly. We've always got it at work, but I end up going. So I actually, my family will lose me down the oral health product aisle in a supermarket because it is interesting, all the claims that they do, and there are some really good claims out there. And so when you delve deep into the science and get to go to the Unilever development place and stuff, they're amazing. But the key message is that fluoride is absolutely groundbreaking.
So we're looking at $14.50 on the back of our packet, and we can buy anything that's on offer, any brand, as long
whatever
as
works for you.
And we have to just brush our teeth for 2 minutes a day. Okay, that's
2
cool.
minutes twice a day.
2 minutes twice a day.
The key one is when you're going to bed.
Right, go on.
What happens is your saliva rate drops overnight.
Yeah.
That's the time we want to make sure there's no sugar looming around. So it's personally, I brush in the morning and at night. That's what we've always done.
Yeah.
But at night and one other time in the day, so it fits into your lifestyle. And these lifestyle things are about understanding when you've got 2 minutes. And that mental health thing, I do find having 2 minutes to think. I don't get that in my day normally. Those 2 minutes are vital, especially when you've got this carnage of children and making sure they've, put the trousers on the right way around, especially in our houses. You do forget yourself sometimes. So those 2 minutes are really important.
Yeah, I also do the mum thing of hiding in the loo.
Yeah, absolutely. Yeah. Switch it on. Switch that lock on and hide away. So toothbrushing is important. So I know in Manchester we've got really high rates of dental caries in kids particularly. What is that about? Can any of you give us any insight into why are our kids got such terrible? Well, I think we've got to really look at this, and actually we've got some of the best teeth in Europe. The actual levels of decay, we're very good on average. The problem is we're not average. In city centre, low social economic areas of Manchester, the areas you guys really focus on have got horrendously poor teeth. So the problem being is the middle class, their teeth are fine now, really, if I'm being perfectly honest. But those Dickensian patients where you've got to take out 20 teeth in a general anaesthetic, they break the heart. They're in the lowest social economic areas in the country. They're the people we see have got really poor oral health. So actually, when the Americans say we've got the British smile, we've got better teeth than them on average. But which average we look at is the difficult part. So when you're sending a child for its dental decay follows lowest the society, social economic, like everything else. So we've got to really now we've evolved our strategies now. We've got to really focus on those marginalized groups because that's where the decay is. That's where we can make such a difference now.
Okay. And when we talk about Dickensian, we're talking about your treatment, aren't you? I guess as a dentist, it must feel awful to have to take out most of the teeth in a mouth rather than people. So it's a reaction, isn't it, to having to do that level of, I guess, intervention. I guess you guys probably prefer polishing and whatever you guys get up to. I mean, I hate going to the dentist, but I do go. But he says to me, "Do you want me to explain?" I'm like, "No, not really. Just let me listen to my music and you go on."
But I think that's really key for the patient. I'm gonna obviously pick on you now, Laura. Is the fact it's in this day and age we need to understand. We understand there is no. You should be able to go into your dentist if you're brushing correctly and do nothing. No polishing. No tartar removal, absolutely anything. So I would also be questioning as a patient, why? Why?
Oh, okay.
I know how you like to question.
This is good.
So it's really important.
I'm up for the challenge. Next time I go, I will let you know, Ben, how much he had to do. And you can give me a gold star. Is that all right?
I always give you a gold star. Then.
Oh, good. That's good. So we've got this problem particularly with children. So I was just thinking about the childcare thing. Last week they said they're going to extend childcare. So it would be amazing, wouldn't it, is to do toothbrushing in childcare and stuff if we've got these problems with children's teeth, particularly in our more deprived areas. So I guess you guys must have trialed this in the past. There must be public health policies on this kind of stuff. What works?
So I I don't want to misquote the evidence, but I know, so I'm based in the Southwest, and I know within the Southwest NHS, they're running a dental reform programme. And a part of that is supervised toothbrushing in schools. And I might be wrong on this, but I believe that they do target that to the more deprived primary schools in the area. So that's making sure they kind of have like a little bus with toothbrushes and toothpaste. So they're supervising children doing that. And another initiative that I'm aware of is sort of training up health visitors as well to be dental champions. And I think that is really important. Again, I'm afraid I'm not well versed in the evidence for that, but I do think it is effective. And I think the supervised toothbrushing definitely does have evidence behind it. Again, especially if it's tailored to where the problem is, as Ben was saying, in those kind of marginalised groups of children with lots of tooth decay, especially as we bear in mind that some of them may not have access to dentists now. It's hard to get an NHS dentist. So that prevention is really important.
And picking up on your point there about like it's hard to get an NHS dentist, it's really hard to get an NHS dentist, isn't it? And even for children, I think for quite a few years in our local area, we've known it's really difficult for adults, but I've never quite experienced it to be difficult for children like it is at the moment. What in, like, obviously I don't want you to kind of, what's going on there? Is that like a funding issue? Is it a capacity issue? Is it a Brexit issue? Is it like we just took our eye off the ball in COVID? What factors are kind of affecting that?
I think it's probably a big combination of those. I think that the access to NHS dentists was getting worse prior to COVID, and it's probably been accelerated from COVID. Very broadly, and I know Ben will come in a minute, the way that like in a lot of healthcare, the way that the government pays dentistry, it's called the Units of Dental Activity system, has been quite unpopular. And it's a bit boring, but very basically a dentist will get paid the same to do 3 fillings as they would if they did 10. So certainly in quite high needs areas, that maybe does not incentivize dentists to work there. And prevention also isn't incentivized under this contract. And sadly, a lot of dentists have been cutting down their NHS commitments or leaving the NHS system altogether. So while we probably, and again, I don't know the figures, have enough dentists, we may not have enough NHS dentists. Okay. And I'll hand over to Ben.
Thanks. It's really important to put sort of into context. We've gone through Brexit. So 22% of the registrants we have a list of people who registered as dentists in the country were non-UK qualified. 22% is a lot, especially when the majority of them work within the NHS. We often find it's really heavily swung to working in the NHS if you're non-UK qualified, because you come for a period, then you leave. And those doors are shut. So we are not getting the top-up dentists coming in. So there's a massive shortage of manpower, and the manpower shortage is in dental nursing, reception team, dentists, dental therapists. It's across the board. It's not just dentists. We've got a massive shortage. Then if you look at the massive boom in aesthetical dentistry, the way your teeth look, all the Hollywood smiles that people want these days, we haven't backfilled that capacity either. So if you say dentists, it's gone up. I think it's gone up from 500 to 2 billion or something like that spent on aesthetical. So we haven't got the dentists gone back in the NHS to do that all the time. There's only so much you can be doing. Even private practices, there isn't enough dentists within those as well. So there's a big drive within all those, and we are still dealing with the backlog from COVID, like you guys are. You know, there is still this fallout of, for example, I was talking to one of my friends who's a cancer consultant, and they used to get about 100, they got 100 referrals a week, and that dropped down to 7 in COVID. But the problem being, there is 100 cancer patients still waiting to be seen on these lists that are massive, and the backfill knock on for everything. So we're still catching up on that. And I know that there's a lot of dentists working very, very hard to catch up with their patients. I know quite a few practices who are back up to date now, and the doors are starting to open. But the key thing for patients, if you've got toothache, and that's often why patients go to the dentist, they only wait till they're having problems, is 111, they have got emergency slots, but they must be for severe toothache, pain that's not reversible by painkillers, swelling and trauma. Will get seen, because I know I ran those services. We had those slots for those patients. But don't leave it till 5 o'clock on a Friday with a toothache. You've had it all week. Learn how to manage this, and you'll get exactly the same in the medical world. When I was at work, it wasn't a toothache then, because if you've got a proper toothache, nothing can stop that, and it's really bad. So it's managing that education and signposting is really critical for patients to understand where to go to. You were mentioning A&E. Often the A&E doctors don't even know that we have an emergency service for dentistry. So signposting is critical, because we used to have to work with all the consultants in our area, and getting a phone call message to the top consultant to then filter things down. It took me 6 months to do that, to say, oh, and then I had a big abuse from the A&E consultant saying, why are you not taking patients? I said, you're not taking my phone call. I've got flyers sorted out. It's all ready to go. But I need you to say yes. We will take patients from you.
Yeah.
And it's that
isn't there as like professionals, making sure we know who else is there.
Yeah.
And like cross our disciplines and cross our kind of professional tribes. That's really important. So do you think, so we've got some Brexit issues, we've got massive understaffing, we've got a backlog from COVID, we've got a problem with the contract. Is there an appetite within dentistry to look at these things, or are we kind of...
There is a massive appetite. We're looking now at contract flexing, where we can take 20% of the contract to actually focus on hard to reach groups, onto emergency slots. We're now we're really focusing, the profession's now developing. The EDA contract's been tweaked over the last 6 to 12 months, so we're waiting for that to change, and that will do. But the big thing to change, we're now focusing on oral health. The fact dentists can say, if you're not brushing your teeth properly, we are not giving you advanced work. So we will get you out of pain, but we'll work with you to heal your teeth. Because otherwise there is no point. If I drill and do lots of fillings and crowns and things, then I'm just putting something on we'll see you again in 6 months, so we'll do them again. It's not right. And also we're now really focusing on the NICE guidelines. So patients, if they've got good oral health, they only see, some of the patients only see me every 2 years. So if I've got good oral health, then I shouldn't be seeing them. That should create capacity, but it's too slow. It's too slow. We need to get things moving, especially for emergencies.
Okay, so it feels like there's a willingness, and some of the mechanics are slowly being sorted out. Is there a role for, like, I don't know about this, but in primary care we are looking at lots of different roles to support primary care, which is quite interesting. So are there cohorts of patients who can be seen by other people, physios and pharmacists, all the rest of it? Is there a role for like a non-dentist assessor? I don't know what that would be, but I'm thinking if actually we want our kids to go in and have a checkup and get used to going to the dentist, it's really important. Does that have to be done by a dentist, or could that be done by somebody else? Or
we did that in general practice. So we had a nurse who used to meet all the patients, go through all hygiene, go through the health, and so it took it off the dentist. We've got things called extended duty dental nurses, so they can do oral health, show you how to brush, disclose, they can take impressions, they can take x-rays, but we don't have enough nurses because they're going elsewhere in the profession. We can get hygienists who can have direct access, so you don't need to see the dentist to get your teeth cleaned, and they can do simple fillings. That's just coming to fruition the last 6 months. We can miss the dentist out, but we don't have enough hygienists and therapists. So those systems have been set up, and we're at the part of that journey. So I think patients need to understand this takes time, but the key message is all dental disease is healable, it's stoppable. Don't eat sugar. Brush your teeth twice a day with fluoride toothpaste. Make sure you know where your dentist is and when you can get to see them. Don't smoke. These are all the same key messages that you guys as medics and all your patients, we all know. My 6-year-olds know this, but we don't do it. We need to change that behavioural change and get it. If we're in we're going to a massive recession, whether we like it or not. It maybe not a numbers recession, but you're seeing the brunt of this. If you cut out sugar, you're going to save money. So stop. It can make massive differences, but that educational journey is so challenging. When you've got a chaotic patient, it's really, really challenging for our cohort of patients. And
I think for all of us, isn't it, making those behaviour changes is difficult. I last week I was like, right, I'm gonna be healthier, I'm going to eat better. So, I went off my little waddly run a couple of days a week. My app gave me a gold star for running three times in a week, and I was eating better. And then I hit Friday and I bought like a whole packet of Percy Pigs whilst I was working A&E, and then that was it. I was well off the wagon then. So I mean, even when we know behaviour change is difficult, isn't it? It's something we have to all keep working on. And I think particularly if your life is pressured, it gets even more difficult, doesn't it, to kind of do that self-care, to value it, to have the capacity in your brain for it and emotions for it. So, but I hear your passion, Ben. I feel like I'd like to walk down a supermarket aisle with you and be like, is this true or not true? All these products, that would be a good game.
It's really good. I've done a few things for BBC with Myth or Lie on just different radio programs. And after a while, you start talking about it, you think, I am such a geek. With dentists, I am. That's it. And I know I can feel that from Christina as well. We are. Once you get into this behavioural change, it's fascinating stuff. It really is. And then when you get into the biome of how the mouth links to the rest of the body, they're now looking at bacteria that cross the oral bacteria in the brain, in joints. And it's actually suddenly, it shows you even a little bit of bleeding in your mouth can lead to serious problems that we don't even know about yet, or take pressure off. With some of that, I was talking to one of the professors down in London, and he said they're doing research with the Premiership football teams to reduce the amount of inflammation by making sure oral health is correct. And those little gains, what it's like at that level, are absolutely fascinating. But then you start thinking, when you look at my chronic patients who mouths are awful, the pressure that must be on their system, we can change that, and we can make such a difference.
That's really inspiring. That's really exciting. That's cool. So we just want to talk a little bit about, we've all got patients, haven't we, who struggle to come and see us. And I think dentistry is one that is actually quite scary for a lot of people. Like, depending when you grew up, going to the dentist was traumatic. I know you guys are like smiley and everything now. My dentist when I was little was definitely not smiley. He was terrifying. And particularly for people who've been through trauma of any kind, I think going to the dentist, not being able to speak, having to lie still, all that kind of stuff is actually really difficult. What can we do as kind of, I guess, professionals that cross boundaries? We're all working with the same people. How can we encourage people to be able to take part in going to see the dentist?
So I think I'm a massive believer and advocate for trauma-informed dentistry. I think it's so important. I think, as you've said, when you're working with kind of vulnerable groups in society, and anyone, because it's a lot more common, I think, than we realise, of adverse childhood experiences. But we know that sort of if you're in the mental health system, if you suffer with a severe mental illness, or if you've been in prison, lots of these things, you are unfortunately more likely to have experienced some of these adverse childhood experiences. And again, that can make dentistry more difficult. I do also think that you're probably more likely to have suffered a traumatic dental experience in the past as well, such as having to go to an urgent dental appointment and have a tooth out, which I think can be, while good to get you out of pain, it can be a really traumatic experience if you don't know that dentist. You're scared anyway. You have to go and have this tooth out, and then that's done. So I think in terms of how the other professionals can support, I do think it is helping us to ask for trauma-informed dentistry and the type of dental services that can help people with this. I think being able to work in a team, which is hard, dentistry is fragmented. I think that where possible, forming links with your local dentist or with your community dental services in your area is really important. I work in a women's prison, and one thing I absolutely love about that is I'm situated within the healthcare department. So I work within the same building as the mental health nurses, the substance abuse nurses, GPs, and the practice nurses. So, and I'm invited to their handover, which is lovely because that's not an experience that I've had before. So to be able to, if they can tell me, or this person is really, really struggling with their toothache, but they're too scared to come and see you, then that conversation I can maybe know, well, maybe I need to see them outside of my surgery. Just go and speak to them first, start to build that relationship so they can come and sit in the chair. And also, if I know that someone has come to see me and is really struggling with their mental health, I can then signpost back. So I think that, you know, it might not be this level of interdisciplinary working may not be needed in some places, but I think when you're working with more marginalized groups and people that have struggled with dentistry and other healthcare problems, it's so important. It's also really important for me because it can be hard, and I'm sure you know, it can be hard sort of dealing with this barrage of oral health and misery from it. So to be able to kind of talk and work as a team is also really important for my own peace of mind.
That's really good. That's really helpful. And I think that dentistry has undergone a massive change, isn't it? Like when I meet dentists now, like you're all just lovely people. You're all aware of issues people have. You know, you're very good at kind of explaining what's going on, at welcoming, you know, people into the surgeries, and I think it's a good thing, isn't it? But yeah.
I think it's also, if we're talking, Christina mentioned something really important there, working as a team, working with the medics, working with everybody else. I've never had a doctor knock on my practice door in 20 years and introduce themselves. We encourage our team to go the other way around. The pharmacist, yes, my local pharmacist, he'd phone me up and said, "But I've got this patient, can you see them?" The answer is yes, because it's a professional phoning up. We've got the respect, and it's actually because I know that I purposely went out and went to the Science Medical Practice in Worsley, sat down with Dr. Sides and went through everything and said, "This is what I can do for you. If you get any patients and you say it's Dr. Sides receptionist on them, I will see them." It's just common courtesy, because Laura, you've got your pet patients, you know what that trauma can do. And I respect that. So having that reach out and that integration is really important. So as a general practitioner, not in the ideal setting, because I've worked in the ideal setting with the homeless situation, I can walk downstairs. But I need that. And we've got this virtual world now. Why can't we just have an oral health thing on the LMC, we're having an afternoon, or vice versa on our local medical dental committees? And actually that integration, putting us back in the profession with the medics is critical, because there's not that many patients out there that we really need to see. But there are ones we can make a massive difference to on a Friday at 4 o'clock. If Laura phones up and said, "Ben, I need this patient seeing, otherwise I know where they're going to end up." The answer is yes. My team will hate me, but the answer is yes. And my team know that, you know, because you don't want to be that patient. You don't. They're struggling with better things, and also I think the patient's got a responsibility to say, "I'm scared."
Yeah.
You naturally have, but having that confidence in that, like a out of hours service, to say, "Actually, do you know what? I really struggle with this." I don't have any dentist who just going to ignore you.
Yeah.
Don't have any of. But if we're aware of that actual acute terror, quite frankly, some patients have, we can adjust to that. So it's communication. All of this can be solved by communication, and it can make such a difference.
That's amazing. That's really helpful. So we want us to get to know our local services better, like go out for a beer with your local dentist.
Let's not get too
You might even like them, Ben. You never know. You might really like your local GP.
Absolutely.
We might have the same conversations about contracts and things, just from different perspectives. So, like, there's a lot of commonality in this, isn't it? We're all struggling with workforce issues, capacity issues, prevention issues, and we're all trying to apply our knowledge and our skill to make things better for people. So we've got an awful lot in common. So I think a dental doctor beer evening sounds like a plan, to be honest. With toothbrushes.
I agree. Sign me up.
So I have one question that my teenage son wanted me to ask. Are you ready for this? So he is like anti-plastic. So he wants to know, are the wooden toothbrushes okay? And is the toothpaste you chew that's not in a tube, that's in a cardboard box, is that all right? Does anybody know the answer to the carbon generation oral care? Ooh.
So wooden toothbrushes, I think yes. As long as you're doing it for 2 minutes and you're
I know the bristles all right, with the charcoal weird stuff on them.
I'm going to hand over to Ben for that one in case I say anything wrong.
There are actually some now electric toothbrushes which are fully recyclable as well, so you can go really along the line. If you look at something like Philips, all their packaging is totally recycled, and you can actually do a recycling program for the head. So going back to wooden toothbrushes, yeah, brilliant, but they're fine. And the chewing, I was about to mention a brand there. I think there's a one called Parlour, and they are a little glass pot with little chewing.
Yeah.
They give you the right dosage of toothpaste with fluoride, which is what you're trying to get inside you. So answer, yes, they are.
Yeah, so we can all go forward and save the planet and brush our teeth. That's all we wanted to know. Yeah. I wasn't sure. I was like, I don't know if it works.
Or you can put your plastic ones into recycling, and then that will solve the problem. So not just let them go to landfill. So it's that job thing, isn't it? It's making sure the bin's been separated rather than just leaving it on the side for mum and dad to do, rather than there is a difference. Teenagers doing it all.
That's brilliant. Well, it's been lovely to chat to you guys, and thank you so much, and happy World Oral Health Day, everybody.
You too, thank you.
This is some amazing smiles down the screen. You can't see them, but these two have got amazing teeth. Thank you.